Hello everyone, my name is Niti Patel. We are three members in our group and we all are going to present a Canadian fitness safety standards. So here is our presentation. So Canadian fitness safety standard has 6 categories. The first is fitness related personnel, second is pre-screening and informed consent, third one is special exercising population, fourth one is emergency procedure, fifth is communicable diseases, and sixth is fitness related environment. Among 6 categories, we are going to explain 2 categories in brief. So first one is fitness related personnel. Fitness personnel shall be certified in the area with which they can providing program service, for example fitness appraisal, personal training, aerobic classes, aqua fitness classes and extra. Fitness trainer or fitness professional can determine whether they are offering the service correctly and ethically by using their professional degree to assess their performance. So, here is a possible scenario where this standard would not be followed. In this scenario, there is a gym that skims on recruiting qualified fitness professionals and fails to set up adequate first aid services to offer their consumers exercises, programs, and services. They engage people without the necessary credential or certification. Furthermore, they lack the resources or trained employees needed to respond to medical emergency and offer emergency first aid, where a customer at this gym had a sudden cardiac episode while doing a high intensity exercise class. The fitness staff might not be able to identify the warning signs and symptoms of cardiac attack or know how to react appropriately because they lack of certification and training. A client may endanger if someone does not have sufficient knowledge of professional degree and certification they possess. Lack of awareness of emergency contact may result in death of certain clients. Another category we included in our presentation is emergency procedure. So, immediate access must be available to in-house first aid services from qualified personnel. Contact information for external medical services, for example, ambulance, hospital emergency phone numbers, must also be posted and phones readily accessible in all high-risk injury area, for example, pools and fitness testing areas. All required safety equipments, emergency first aid supplies, and instruction on how to contact medical services must be present in the facilities.
So here are some possible scenario where these standards would not be followed. So the first one is lack of trained personnel. The shortage of trained personnel in first aid happens because there are not enough training programs and not enough resources allocated for training and equipment. There are not many comprehensive training options. So it's hard for people to become skilled responders. And the another is absence of contact information. Sometimes organizations forget how important it is to have easy to find contact information in emergencies. They may not put up clear signs or realize that they have legal responsibility to provide this information. They might also forget to keep the contact details updated. It's really important for organizations to understand that they need to have visible and clear emergency contact information. This way, people can quickly communicate and get the right help when sometimes critical happens. So the third one is non-functional or inaccessible phones. So even if contact information is displayed, the effectiveness of summoning external medical services can be compromised if phones are not readily accessible or functioning properly. So this situation arises when phones are not easily available or not in good working conditions, making it challenging to request immediate assistance from medical services services during emergencies. And the last one is non compliance with regulatory requirements. So, in some cases, organization may lack awareness or intentionally disregard legal and regulatory requirements that mandate the provision of immediate access to first aid services and contact information for external medical services in high risk areas. So, this situation occurs when organizations are either unaware of these obligations or concisely choose not to prioritize them, potentially harming the safety and well being of individuals in those high risk areas.
Let's discuss the connection. So both Standard 2 and Standard 11 are necessary to ensure the security and well-being of those who use fitness facilities. Certification guarantees that fitness professionals are competent and experienced in their fields, and emergency protocols guarantee that in case of an emergency, first aid services and the number of calls for outside medical services are readily available. So, what is the purpose of this standards? By demanding certification for fitness professionals, Standard 2 aims to uphold professionalism and safety. This guarantees that they have the know how to offer safe and efficient fitness routines. Standard 11 intends to implement emergency protocols in order to quickly and efficiently treat medical situations. This provides quick access to first aid assistance and information on how to reach outside medical services. Both standards support high standards of professionalism and safety within the sector and prioritize the health of those using fitness facilities. Furthermore, how we can practice these standards in our practical life. So, in real life, fitness centers should place a high priority on finding and hiring certified fitness professionals to guarantee that the fitness staff are knowledgeable about current business practices and capable of carrying out their responsibilities effectively. Enough resources and training programs should be made available. Furthermore, fitness centers must set up and maintain appropriate emergency protocols, which should include quick access to on site first aid assistance, contact information for nearby emergency medical services that is prominently displayed, and the availability of all required safety gear and emergency supplies. And at the last but not least, to summarize the main takeaways from the activity, emphasizing the significance of these standards in promoting a safe and effective fitness environment, highlight the benefits of fitness personnel certification, such as ensuring expertise and client confidence, stress the importance of emergency procedures in handling medical emergencies promptly, thereby prioritizing the well-being of individuals in fitness facilities. Conclude by emphasizing that adherence to these standards upholds professionalism and safety within the fitness industry. Here we have created a Kahoot multiple choice question test. In that there is questions related to CFSS guidelines and the standards. So please go through it, and thank you very much.